I'm David McLanahan, and thanks for joining us during these difficult times of unrest all over the place and in the atmosphere, and you probably sheltering at home to stay out of the smoke, and with all your doors and windows closed, at least here in Seattle. I don't know about you other guys elsewhere. I've been to Cuba in 1980 and again in 2005, and I'm a big fan of how the medical system is set up and the results that it's been achieving basically ever since independence, or the revolution, I should say. First, I'll give you a little bit of history about the PNHPWW chapter's connection to Cuba. Next, Cindy Domingo will give an overview of the Saving Lives campaign in collaboration with Cuba and the work of its subcommittees. And as you all know, for decades, Cindy has been a leading activist for a number of social justice issues. She was a longtime chief of staff for King County Council member Larry Gossett, and is chair of the US Women in Cuba collaboration. And Cindy, as she said, has led a number of delegations to Cuba. Is there anybody else that's led more, Cindy?
I don't know. I don't know in the Seattle area.
I would doubt that. So later I'll go into more detail about the 4 asks of the Saving Lives Medical Subcommittee. Saul Bockelie, who is graduating next year from the Latin American School of Medicine in Havana, also known as ELAM, in the US, now awaiting transportation back to Havana for his final year.
My name is Saul Bockelie. I just finished 5th year in medical school. It's a 6-year program, as probably everybody knows. And yeah, born and raised here in the Pacific Northwest. And I'm back home for the summer. Came here to take step 2 CK, and just took that a little over a week ago. And now I'm stuck here and waiting to fly back to Cuba, but the airport's closed. So so just waiting to go back to school. Now I'm supposed to head back mid-October.
Okay, so I want to give you a little history of how our PNHP Western Washington chapter was intimately involved with Cuba since its inception in 2006. 2 of our board members went to Cuba on a trip in 2005, and on that trip was Quentin Young, who my pointer's over his face right here, and here is Hugh Foy and myself. And we were part of a medical delegation that was looking at their healthcare system from top to bottom. And we also had a chance to look at the Latin American School of Medicine, ELAM. On that trip, Quentin says, well, we hear that Seattle's such a liberal place. Why don't you have a PNHP chapter? And Quentin was a co-founder of National PNHP, and of course, an icon in Medical Committee for Human Rights and Healthcare as a Human Right, and was MLK's doctor when he was in Chicago. So what could we do? But as soon as we got back to Seattle, we called people together, and we had our first official meeting in 2006, and have been having monthly meetings ever since then. We've had a number of annual public meetings, but not in the last couple of years. But hopefully we'll be having one between the election and the new year. This is when our delegation was meeting with some US students in ELAM who were there studying at the time. Our chapter helped support Ramon Bernal, who was the first Seattle medical student who went to ELAM. And he started, I guess, in 2007 or so. And Ramon was really an amazing guy. Every month he sent us a report on what happened in that month while he was studying at ELAM and working in the Cuban medical system. And usually he sent 2 or 3 pictures of what was happening. And this is just a list of all the, reports that he sent to us. And I was hoping that someday somebody put together this in a bound publication, because it's really got some really amazing information in it. And this is Ramon right here with some students in ELAM. And here he is again, and this is one of his reports, dengue fever in Cuba, and I can't scroll down there. And this is Ramon, and unfortunately for Seattle, he fell in love with a fellow student from Paraguay, and they both went to Paraguay after they graduated. What is the Cuban experience with the pandemic? Well, Cuban has quite a bit of success at home in limiting the spread of COVID-19. With 11 million people, they have had just 4,352 documented cases as of a few days ago, with 102 deaths, and notably no deaths in their healthcare workers. They have a vaccine that they just started testing a couple weeks ago. They're using interferon alpha B recombinant in their overseas Henry Reeve's brigades and at home, and they've documented some improved results. This is a medicine that's not available in the US. The Henry Reeve's brigades are working in 30 other countries at this time across the world that are helping those underdeveloped countries, mostly in places like even Italy and several in Europe, that have asked them to come and help out with. What else? The US is still blockading and sanctioning Cuba and intimidating other countries not to accept the Cuban medical support, not to accept the Henry Reeve's brigades, which is just unbelievably, horrendous. So, Cindy, you want to talk about the Seattle-Cuba Friendship and the Saving Lives campaign? Give us a nice overview of that.
Thank you, David, for asking me to speak, and hello to a number of old friends here, Mindy and Paul and Steve Bach, and Deb Goldman, who is also here. She's a nurse, and she's with an organization that I'm chair of, US Women in Cuba Collaboration. Chris Four is also with the Seattle-Cuba Friendship Committee, and probably could talk more about the Seattle-Cuba Friendship Committee than I can, because he's been involved longer with that organization. But first, let me introduce you to the Seattle-Cuba Friendship Committee, and then I'll talk more about our campaign, which is called Saving Lives Campaign. So the Seattle-Cuba Friendship Committee is a Seattle-based organization composed of other organizations and individuals. And we are dedicated to educating Western Washington people about the truth about Cuba, to refute the lies that the US government has spread about Cuba, but especially to lift the 60-year-old blockade, US blockade against Cuba, and hopefully to change US foreign policy towards Cuba and to normalize relations between our two countries. And by normalizing, we would really like a US policy that is more humane and respectful of other countries' sovereignty. The committee, the Seattle-Cuba Friendship Committee, participates in the annual Pastures for Peace caravan that on normal years, every year would bring people to Cuba without the license that US foreign policy requires. And the Friendship Committee is also part of the national coalition called National Network on Cuba. So the Saving Lives campaign was a national campaign that was an outgrowth of an effort of about 70 organizations from the US and Canada, who were actually organizing a national conference on Cuba that was supposed to have taken place last March, but because of COVID, we were not able to do the conference. We are going to have like some mini national meetings after the election, which will talk about how we can utilize the results of the elections to hopefully, Trump will not be reelected, but how we can move forward with some of our work to lift the blockade. This national conference we were supposed to have last March was probably the broadest effort ever to come together to organize in support of Cuba and to lift the US blockade. While we postponed that national conference indefinitely because of COVID-19, we knew that our work was just beginning. And we knew that we had to do something around the pandemic. As you all know, the pandemic by definition is global. And what became so clear to us is that Cuba has always had a global perspective when it came to healthcare. And because the pandemic is global, it's necessary in this period to put aside political differences, to call on the world's medical expertise, and to call for international cooperation in this fight against COVID-19. And it's necessary in order to save lives, and thus the name of our campaign, Saving Lives. We also know that for communities of color, COVID-19 has a disproportionate impact on the communities of color. Back when I haven't looked at the latest statistics in terms of the disproportionate impact of COVID-19 on our communities of color, but in July, the COVID-19 in the African-American community, 3.6% times higher rate of COVID-19. In Washington State, Pacific Islanders are hit the hardest, with the Latino community, especially in the Yakima Valley, being hit the next hardest, and then African Americans. So this really is about calling on the world's cooperation, using the best medical expertise to try to save lives. So concretely in our campaign, we're calling for three things. One, to allow US Cuba Canadian medical, clinical, and scientific collaboration, including inviting Cuban medical brigades to provide direct medical assistance and or to provide advice and guidance to treating COVID-19. Secondly, to incorporate Cuba's interferon alpha 2B recombinant in clinical trials in the US, Canada, and the World Health Organization, and the granting by the US Food and Drug Administration for approval to begin testing on Cuba's interferon alpha 2B recombinant. And I think David's going to talk a little bit more about what the interferon is and why we think it's important for the US people to be able to begin tests on the interferon alpha 2B recombinant and other medications that Cuba is using throughout the world with its medical brigades to treat, prevent, and to stop deaths of COVID-19. Thirdly, we are calling on an end to US economic and travel sanctions against Cuba, and that includes its extraterritorial nature and the attempts to stop all other countries accepting Cuban medical brigades and assistance in all ongoing measures that prevent Cuba from accessing and importing medical equipment and medicines to confront COVID-19. Early on in the fight against COVID, a Chinese plane full of personal protection equipment was stopped from landing in Havana because they said it was a violation of the blockade. However, it was not, because the US blockade does allow these types of medical equipment to go to Cuba. But our president has a policy of continuing to harshen the blockade and stopping planes like that. Our campaign has three very active committees working towards those three demands that I just mentioned. So let me briefly cover two of those committees, and David is going to talk more about the third committee, the medical committee, which he serves on. And so, we welcome any of you to participate in the bigger meetings of the Saving Lives campaign, which meets every other week. If you're interested in the bigger campaign of Saving Lives or any of these committees, we welcome your participation as we continue to grow this work Even after the election, no matter who becomes president, this work will continue to be important, especially as the pandemic continues, and especially given the number of deaths and infections that continue to occur in the United States. So the first committee that I want to talk about is the Resolutions Committee. And that meets every other Monday at 5 p.m. over Zoom and is chaired by John Waller, who is also the chair of the Seattle-Cuba Friendship Committee. Some of the members of this committee have worked previously on resolutions in various cities that supported lifting the US blockade against Cuba. And that was a campaign that was launched a couple of years ago by the National Network on Cuba. And that resulted in about 13, and continues to grow, 13 resolutions that supported lifting the US blockade. And so those cities included Richmond, California, Berkeley, Minneapolis, Cleveland, St. Paul, and other cities, and I'll talk about Seattle later in a little bit. It was important to show, especially during this period of the Trump administration, that people saw that the blockade was inhumane and that it was doing nothing to build people-to-people relations, and that city by city, there was support to lift that blockade. So in light of these cities having passed the lifting the blockade resolutions, many of us felt that it was important that maybe passing resolutions in support of the Saving Lives campaign with the 3 demands that I covered earlier would do the same thing in terms of publicizing not only the role that Cuba plays in the world around ensuring that healthcare is a right that all people around the world deserve, but that it was important to know the contributions that Cuba has made and continues to make in the fight against COVID-19. So we're doing the same type of resolutions with our 3 demands and some variations that include working in cities with the various public health departments and boards as a way to promote the Saving Lives campaign and the role that Cuba plays internationally around the battle of COVID-19. At this time, we're not just sticking with city councils, but there has been work with some state legislatures, but as well as labor councils are important because they represent sentiments of working people and the organizations that represent them. In terms of cities that have passed Saving Lives resolutions include San Francisco. And San Francisco did not have a resolution around lifting the blockade, but they have a resolution that is their board of supervisors are pushing to work with the public health board in San Francisco and Cuba. Richmond, California, Minneapolis. There are other cities working on resolutions in Sacramento, LA, New York, Chicago, Cambridge, Massachusetts, and of course here in Seattle. So I want to talk a little bit about what we're trying to do here in Seattle. We are really at the beginning stages, and we have approached City Council member Teresa Mosqueda because she was the City Council member who sponsored the original lifting of the blockade resolution that passed, I think it was last year. And part of the success of that was that her father, Professor Larry Mosqueda, had just happened to go to Cuba last May Day with us. And so we are using a resolution, and we're going to modify it, that we actually passed recently at the MLK Labor Council. And that resolution at the MLK Labor Council is significant because the MLK Labor Council represents more than 150 unions and 100,000 workers. And MLK labor resolution will be taken up at the statewide convention of the Washington State Labor Council next week. And that resolution was sponsored by 4 of the constituents, AFL-CIO constituents of color, the A. Philip Randolph Institute and the Coalition of Black Trade Unionists, which represent trade unionists in the African American community, the Asian Pacific American Labor Alliance, and LACLA, which represents the Latino workers in the AFL-CIO. And at the request of MLK Labor in these constituencies, the Washington State Labor Council, which represents 600 union locals in council and representing 500,000 rank and file union members in Washington State, will be taking up that resolution. We would be the first statewide labor council to pass the Saving Lives resolution in the whole country. So we are starting an all-out push for the City of Seattle resolution, and it's important to do it now. We understand that the City Council has been very busy with Black Lives Matter, defunding the police, and Council Member Mosqueda is the chair of the budget this year. And so we are hoping in the next few weeks to push for the City of Seattle resolution before budget starts. And we are asking all of you to email all members of the council and ask them to sponsor, co-sponsor, and to pass the resolution. I'll be drafting the final resolution, sending it to Council Member Mosqueda and other council and the whole council, asking them to pass it. And David can forward that resolution to all of you, and you can write the council members to sponsor that resolution. Likewise, many of these resolutions are on the website, and I can put in the chat box after I get off the website for the Saving Lives campaign. And some of the resolutions are on that website, as well as there was a letter signed by legislators in Minnesota, a letter to the governor asking the governor to take up the Saving Lives campaign. And there are other resolutions on the Saving Lives campaign website, as well as a how-to guide. The second committee that I've participated in is the media committee, which meets on Sundays at 1 o'clock. And essentially it's about getting the resolutions publicized, but especially to combat the negative or blackout around Cuba's role in the world around the battle around COVID, but as well as the many decades that Cuba has contributed to the healthcare of the world. And we are looking for alternative media, but lately we've been getting some positive mainstream media coverage that has been coming out, but that's just more recently. And on the media website, you'll find a fact sheet on the Cuban medical, on Cuban medical internationalism, and what is Cuba's interferon alpha-2b recombinant. They are working on an op-ed, developing media lists and contacts, compiling media coverage, and following up with reporters that have done some work around Cuba. So if you have any media contacts, this media committee would really appreciate being in contact with any media that you have, or areas, places in which we can reach people about the role of Cuba in COVID-19 and the Saving Lives campaign. Lastly, I hope that you will all go on the website and become endorsers of this campaign. All of you are activists, and some of you have some very prominent names in the medical field, and we would appreciate your endorsement of this campaign. And also on the website, that's the home of the Saving Lives campaign. There are a number of webinars, some that relate to Cuba's medical role in the world, as well as their role in battling COVID-19, that I think that you will find very interesting. This month, there's going to be a couple of other webinars about the school that Saul attends, and about the Henry Reeves Brigades that David is going to talk about. We are fortunate in this area to actually have supported, I think, 3 students at ELAM. Saul, whose father is part of the Seattle-Cuba Friendship Committee, and Bernal, who was our first student. And we have a third student who came to us after she graduated from ELAM, Sochi Garcia, who lived at my house for a couple of years and is still trying to pass her boards. And she's in Mexico now helping in the community there with healthcare, and has also served in Haiti. So we are fortunate to have hosted and to have sent and awarded 3 students to the medical school in Cuba. And that's been our great contribution from the Northwest. Thank you.
Well, thanks, Cindy. You just gave us a wonderful report there. And within a day or two, I'll get out a meeting report with all the links, so you can just,
Okay.
Have that and download it and keep it and follow the links so you can help participate more, as you may like to do. Also, I'll edit a video of this meeting tonight that, I don't know, you can recommend it to somebody who was unable to be here tonight for whatever reasons. So I'm going to talk about, I'm on the medical committee of the National Saving Lives campaign. And so I'll talk about a little bit of what our committee has been doing here. I'll use some slides for that. Okay, the medical committee basically has 4 asks. And these are asks that we're sending to, our email lists, and people on the medical committee have, lots of healthcare contacts. So first of all, the first ask is to sign on the campaign to support the Henry Reeves Brigade for the Nobel Peace Prize. And I'll send a link to that so you can actually put your name there as somebody who would like to see these amazing brigades get the next Nobel Peace Prize. More than 2,000 Cuban health professionals, doctors, specialists, and nurses were requested by 31 countries in Europe, Africa, and the United Arab Republics, as well as Latin American and the Caribbean, to help them in the global health crisis, and are now working in those countries to treat the sick and contain the COVID-19 pandemic. Other requests for cooperation are underway, constituting the only international medical contingent to provide scientific and humanitarian response to the COVID-19 pandemic on a global scale. So we are requesting support by signing the petition to the Nobel Peace Prize Committee to nominate the Cuban Henry Reeve International Medical Brigades for the next award. And I'll send you the link to do that. Interestingly, Henry Reeves was an American who, basically served overseas to help support people in underdeveloped countries. The second ask, well, there's this one. The second ask is to ask for collaboration with the US healthcare system people, with the Cuban healthcare system people, who have learned a whole lot about the COVID virus, and they're both treating it in their own country of Cuba and also internationally. And it would be wonderful if they could come here and collaborate with our physicians and Also, places like the Indian health, basically reservations that are some of the most impacted by poor health care. So I think Cuba has, would be interested in coming here. Of course, we've got to have somebody ask them to come here and help them with training our doctors and things they've learned overseas and in Cuba themselves. So we need to pressure our government to collaborate. So that's one of the missions of the medical committee. So there's a link here to join the Saving Lives campaign that I'll be sending out. So obviously we want to end all the economic and travel sanctions, which are just horrendous, and preventing healthcare where it's needed most, and not just Cuba, but other countries. The United States is trying to stop other countries from inviting the Reeve Brigades to come in and bad-mouthing them as being, human trafficking and all sorts of ridiculous things. So we urge your support to work with, sending letters to your politicians or whoever to end the government sanctions. Cuba has been using some drugs that aren't available in the United States, such as the one that Cindy mentioned, the interferon alpha beta alpha B recombinant that they've used in Cuba and at their brigades, and shows that in combination with some other drugs they've had a very good effect. So we are not using that in the United States. So we're asking for collaboration and maybe some trials, and it's not unheard of because in the past Cuba and the United States have cooperated on some randomized clinical trials, notably around the Cuba-developed lung cancer vaccine. So we want to end the travel restrictions and the sanctions, and Cindy covered that. So next thing is regarding the Latin American School of Medicine in Havana, or ELAM. For decades, Cuba has granted free medical education to students from all over the underdeveloped countries, and I think there's something like, 20,000, what was the figure, to date have been trained there and gone back to their countries to help out where they're needed most. And that actually includes 200 US graduates from ELAM, with about 70 more at different stages of training. And we'll hear from Sal Bockelie a little later on about that. So these graduates bring with them the Cuban commitment to accessible, prevention, and based healthcare. I'm going to show a short video of ELAM and the recent US graduating class.
ELAM, the Latin American School of Medicine, was formerly a naval base located in the outskirts of Havana that was converted into a medical school by the Cuban government. When President Fidel Castro came to the United States to address the United Nations, it was really at that time that he extended this offer to provide these scholarships to young people in the US, with the only understanding being that when they returned home, they would practice medicine in underserved communities. In the year 2000, IFCO was leading a delegation of Congressional Black Caucus members to Cuba to learn more about the reality there. And it was then that Mississippi Congressman Benny Thompson remarked about the incredible health disparities in Mississippi.
I said, look, we are willing to grant a number of scholarships jóvenes,
for youth
pobres de su distrito.
for youth from your district.
When Fidel Castro initially made the offer, it was, of course, seen as a wonderful gift. But I think that there were really many people who didn't believe that it was possible. It was my father, the late Reverend Lucius Walker, who was the executive director of IFCO at the time, who believed that this was indeed something that could be done. And it was through his efforts that IFCO actually developed a process for recruiting, mentoring, and nurturing these students throughout their 6 to 7 year medical school training.
My name is Alexandra Skeeter, and I was asked to share a message with Garvey Fest on behalf of the Wisconsin Coalition to normalize relations with Cuba. Because for the past 6 years, I have been studying to become a doctor at the Latin American School of Medicine in Havana, Cuba, started by Fidel Castro in 1998 as a response to the growing need for accessible, preventative, holistic healthcare worldwide. During this COVID-19 pandemic, we've all witnessed the incredible Nobel Peace Prize-worthy humanitarian relief efforts of Cuba's Reeve International Medical Brigade. Just one example of the medical advances and support that Cuba has contributed to the medical community worldwide, despite the extremely inhumane and oppressive economic blockade imposed by the US. Imagine what Cuban medicine could do without limitations. This is why we must continue to call for the end of the economic blockade. Not only does the blockade negatively affect Cubans, it affects all of us. It has the greatest impact on Black Americans and Black folks worldwide. I'll explain 3 ways Cuba's healthcare system has made advances that would improve health outcomes for the Black community. In Cuba, healthcare is accessible to all people, which contributes to the country's high life expectancy rate. It is even comparable to that of the United States. Cuba is able to achieve these health outcomes at 1/3 of the cost the United States spends because its healthcare system prioritizes the health of its population over the wealth of corporations. Here in the United States, hospitals face understaffing and are being forced to close because they are deemed to not turn a profit. These are issues you do not see in Cuba, and in fact, you see the exact opposite. Cuba continues to see days without new COVID cases and has not stopped exporting doctors around the world during this global crisis. Cuba is even willing to provide medical care to US citizens, which would benefit Black and Brown communities that are disproportionately affected by coronavirus. But of course, the blockade prevents this from happening. Every year, diabetes claims the lives of thousands of Black Americans, and almost 1 million US citizens are diagnosed with diabetic foot ulcers, a condition that increases the risk of lower limb amputations. Annually, an estimated 60,000 people in the US undergo diabetic foot amputations, many of which could be prevented by the Cuban advancements recently made in this field of study. In 2015, Cuba eliminated the transmission of HIV and syphilis between mother and child. Medical advancements like these are especially important to note as HIV and syphilis also disproportionately affect Black and African people. One of the directors of the World Health Organization noted that eliminating the transmission of a virus is one of the greatest public health achievements possible, and that this is a major victory in our long fight against HIV and sexually transmitted infections, and an important step towards having an AIDS-free generation. However, because of the economic blockade, many do not have access to these life-saving treatments. Marcus Garvey reminds us that with confidence, you have won before you have started. And so I leave you with all the pride, confidence, and determination Cuba has taught me, and invite you to reflect on what being in solidarity with Cuba and the Black community looks like in your life. Thank you for allowing me to share with you.
Lean on me when you're not strong. I'll be your friend. I help you carry on.
Isn't that amazing? So, Saul, can you give us a little information about your experience first at ELAM and then in working clinically in Cuba during your clinical years?
Yeah, sure. So I'm, like I mentioned in the introduction, I'm in my 5th year there. And so the first 3 years, the first year is like pre-med, and they're kind of introducing you to the culture and Spanish classes and things like that. And the next 2 years are spent out at that naval base that was in the video, and that's where they're not the clinical years. You're just kind of learning. It's textbook. You do have some experience in some of the smaller clinics around the school out there, but we're kind of isolated out on the coast outside of Havana, and it's great. That's the international school where, like they said, there's 100 plus countries represented, and so it's a really unique experience in that way. You walk around and hear Arabic, French. I was living with a Palestinian for 2 years, and I'd traveled to Palestine with him one summer. So it's a really unique experience for medical school, and just you make so many connections. And then after that, you move. All those international students get separated and put in hospitals around the country in Cuba, except all the US students, for political reasons, they keep us in Havana closer, and we're a very small delegation. There's 10 of us a year, and so we're a pretty small group. Other ones like South Africa, they've had like 500 to 1,000 students per year, so it's we're really small compared to other countries, our representation. But we stay in Havana in the city, and so I'm at Hospital Nacional, and I've been there for 3 years now, going into my last year, which is the intern year. It's a wonderful experience. Everything that Alex, that girl, the doctor who was just speaking, she's in my class. She's one of my best friends down there. So that was great seeing her in that video. But everything she said, it's true. We learn, to be doctores de ciencia y conciencia, like doctors of science and conscience. Like we're learning not just about medicine, but how politics play a role in medicine, and how to be a humanitarian and be a doctor, and how important that is. How really the economic system, culture, ethnicity, all these things play a role in healthcare. And to really be a better provider in your community, you need to integrate yourself in that community and be more of a humanitarian to provide the best type of care. So with COVID, I was really fortunate to have been able to play a part in Cuba's response to COVID-19 as a medical student. So I was supposed to be going into psychology, and I was in public health when classes got canceled. All students weren't allowed in the hospital at that point, and we weren't allowed to have patient contact. So we kind of did the distance learning from a distance, like they were doing here. But I think we were really fortunate to be able to be involved in what's called the pesquisa, which I had already had experience with. And what the pesquisa is it's community screening. And so we usually actually do that every year down there. For the last one, I think I was involved in was in 4th year, and it was it was just during flu season down there. And what you do is you're going house to house in a predetermined community. So for COVID, I was with a partner, and we had 64 houses that we would go to initially every day. And then it moved to every other day, and then every 3 days as the months went by. But we're going around house to house and just checking in on the patients, especially the people who have pre-existing conditions, or elderly people, or anybody who is immunocompromised. And we're taking temperature, just asking about any contacts they may have had, things like that. And that's all on the medical students. So it was great to be a part of that. And one thing that I really liked about that experience was we were able to help with the administration of what's called Provingovir, which is another unique Cuban drug. It's a homeopathic preventative medication that they actually used previously for H1N1. And so they thought why not try to use it for this to see if it helps with the prevention of COVID-19. And so it was great to be able to help with that, getting that out into the community. It was given to administers to like I said, elderly patients and anybody with pre-existing conditions, or pregnant women, things like that. And like I said, it's a homeoprophylactic, and I think that was another really unique thing that Cuba does. And it was great to be a part of that. And it ended, so I started in March, and I was helping with it all the way until I left the country in July. And then they kind of stopped it after I left, and now they've started up again as this school year started. So I'm excited to get back and hopefully be involved in that once again.
Well, it certainly is different in this country, isn't it?
Yeah. It's really unique coming back here and kind of seeing the lack of coordination, and coming from Cuba, where it's very, you know, the public healthcare system there is very strong, and they've just had a very robust response to it. The population, everybody's very much in sync with each other on you know, wearing masks, maintaining distance, staying home. I mean, nobody likes being in lockdown, but that's, everybody kind of is just, this is a real thing. We all have to go through it. One of the great things I noticed they did was, and it's to this day, but every single morning at 9 a.m. they have the head virologist come on television on their news, which pretty much all Cubans watch, and give the updates and remind people about wearing masks and remind people about maintaining distance and basic hygiene, things like that. And he gives a rundown of what's going on in terms of the vaccine trials, or drugs that they're going to be using, new trials that are going on, not just in Cuba, but in the whole world. And so it makes the whole population kind of it puts the whole population on the same page, and just has made the response so much better. Like you were talking about the numbers out, last I saw, it's what, 4,876 cases, 109 deaths. So they've done a really great job, and that's thanks to the public healthcare system and the primary healthcare system there.
Have you thought about where you might like to practice once you graduate? Hopefully you're coming back to.
Yeah, I definitely want to come. I mean, I'm from the Pacific Northwest. So like I said, I just had taken my Step 2 CK. They've canceled CS. I don't know if you know that, but one of the other board exams recently because of COVID. So I'm not sure how that's going to work out. But yeah, I've met with a few resident directors here in Western Washington. I'd like to do residency in Washington, but anywhere I'd be happy. But ultimately, yeah, I want to practice medicine, family medicine here in the Northwest is my plan.
Well, if we could help with some fundraising and you know, spreading the message, we'd be into doing a house party for you.
Oh, great. Thank you. That'd be much appreciated. And yeah, I really want more people from this area, from Washington, Western Washington, any Washington area down there, because we're not very well represented. So yeah, recruitment. I'm always trying to find new people to join the program.
That's one of the things the medical committee of the Saving Lives campaign is doing, is you know, trying to put out information about how people who are interested can find out more information and you know, apply to the ELAM.
Yes, yeah.
So Hugh Foy, he's one of the co-founders of PNHP, who was on that trip to Cuba with Quentin Young 15 years ago.
Yep.
Say something.
Well, I'm really impressed, Saul, and not surprised at the things that have gone on in Cuba. I recently did some reading and some little research, put together a talk about pandemic history, and that the model for distribution of polio vaccine in the United States in the late 50s and early 60s was actually based on the Cuban CDR model, which was pretty amazing. You know, the for those of you that don't know, CDRs are like your neighborhood government office and outpost, the Centers for Defense of the Revolution. And it's kind of a place people can drop in, and they're responsible for organizing a group of people of about 3,000 citizens. And I thought that was really amazing to go back in our history to realize that particularly in that time, which was very controversial with our relationships with Cuba, that they took the model of the CDR to help us better organize the distribution of the polio vaccine. And I can remember that as a kid, lining up to get my sugar cube, and also lining up to say hello to the 14-year-old kid who was in an iron lung at the county fair in a semi-trailer. But I was wondering, Saul, you're in your 5th year now, so you're doing clinical rotations. Have you had any contact with the University of Washington School of Medicine in terms of doing some rotations and clinical experience here?
So I was actually, I applied and got into a sub-I out in Yakima because I'm really interested in rural medicine. And so I applied and got into a sub-I out there. And I remember reading in the New York Times, this was while I was still in Cuba, that there's this huge outbreak occurring in the Yakima River Valley, as Cynthia Domingo was mentioned. And 2 days later, I got an email that said this program is indefinitely closed. And so that was going to be my clinical experience in the US. And unfortunately, it was canceled. So I other than studying here, I got some time. It wasn't anything like a sub-internship, but I was with a physician out here in Kitsap County.
Yeah.
A little bit. So, but yeah.
And where's home for you? Where do you live, Saul?
I'm from Bremerton.
From Bremerton.
Yeah.
So you can give me a call, or my email address is just hughfoy@gmail. And I'll see what I can do in terms of getting you plugged into some clinical rotations. If not over there on the the Kitsap side, at least maybe here in Seattle. We have a lot of docs here in Seattle who are very much interested and have been allies in terms of the efforts in Cuba. And we can do all we can with the School of Medicine. I used to work with those people for some time, and so we'll try and get you into some clinical rotations here locally if you're interested, so that you can keep your clinical momentum going.
Yes, I'm very interested. That would be perfect. Like I had said, I'd met with a number of directors here, and what we hear a lot being an international graduate student is, do you have experience in the US, like real hands-on clinical experience? And so yeah, that would be really helpful. So thank you.
Yeah. If you could send me your CV too, I can forward that and have a little bit of material to help support your applications. But while you're here, it'd be great for you to get some clinical experience. And I worked at Harborview for over 25 years, so I can see what I can do to get you into some rotations down there. But there's people in the Indian Health Clinic and some of our community clinics that are very sympathetic to the cause. So we'll do everything we can to get you some real on-site clinical experience.
Great. Thank you.
You're welcome. And congratulations. That's an amazing endeavor for you to go to Cuba. And having visited ELAM at one time, we were extremely impressed with the whole institution and how well students have done since they've gone there. So
yeah, it's an amazing school and community.
Yeah, I can imagine.
Question?
Dana.
Yeah, hi Saul. I'm Dana Iorio. I'm a board member of PNHP Western Washington.
Vice President now, right?
Oh, Vice President, I guess. Yeah. Anyway, I'm curious what the economic effects of the pandemic had on Cuba. Were people told to stay home from their jobs? And if they were, how were they supported? monetarily and food-wise, et cetera. I know health-wise they were totally covered, but as far as the economic effects on the whole island, what were they? I'm curious.
That's a good question. So being a medical student there, I feel like that's kind of my area, and I get asked a lot of questions about economics there, which I really, it's a very complicated situation, and I don't think I'm the best person to answer that question. But so my partner is Cuban and works in an Airbnb down there, and so people in that situation, like in the tourism industry, they just got like kind of lost their jobs, and a lot of people are struggling a lot. They do continue to give, you know, the food, like rations, I guess is what I can't think of what we call them in English, but they're like these libretas, little booklets of, you know, you get so many eggs, you get so much chicken, you get so much bread, flour, whatever per month. So nobody's starving or anything like that. But yeah, a lot of people I know have lost their jobs. And so it's very difficult. One thing I know that they've changed since I've got back, which is just a reflection of how bad the economy is taking a hit because of COVID, is they're actually now taking US dollars. The government prefers US dollars. So if you go there with, before they heavily taxed it and they didn't really want it that much, but now they've taken that tax away, and there's specific stores set up just for the US dollar, which I think is a sign of how bad it's gotten. Like they're missing all that tourism money. And so, yeah, it's had a huge negative impact. And a lot of people have lost their jobs.
So, you know, just to add, remember that most Cubans don't pay rent or mortgage. So they are not going to be like the 40 million possible people thrown out in the United States and become homeless. They'll always have a home and shelter. Their salary, some workers, some public sector workers are given a portion of their salary, but you know, because of the blockade, a lot of people in Cuba are really, even though their salary, according to what we get paid, is small, it's like what Saul says, they're still giving food rations. And if for some reason the elderly, the most vulnerable, because of the public health system, and still in some areas, the CDRs, they're going house to house, making sure that elderly still have food. You know, they're being taken care of if they have any needs. I have one of our tour guides that we've used every year for the last 7 years. She said she lives outside of Havana, and her apartment building in the beginning days, in the beginning months of the pandemic, their apartment building was visited 3 times a week, temperatures taken, and especially for the elderly, every day asking, do you need anything? Do you need food? Do you need whatever, medicine, whatever? We will bring it to you. So as Saul says, their system, their safety net is far better than our safety net in so many ways, even in spite of the blockade.
Yeah, thank you.
So I'm going to take this opportunity to introduce Walter Teague, who's down here from Baltimore, I think. He's one of the heroes of the anti-Vietnam War movement in New York in the 60s and 70s. And I know every time I Zoom with him, he's got a picture of Cuba in the background. Walter, are you awake there in the, can you say something?
I'm very impressed and pleased and happy to see you guys doing this. Thanks for the compliment. I have been to Cuba 4 times and I learned something every time. And now in this crisis that we're all going through, I'm learning quite a lot from friends, neighbors, and family. And it's difficult all over the world, I think. And but I think it's precious when we can help each other. And that's what the main thing that I appreciated about Cuba. I'm a retired social worker, as part of my activism. And something I learned is that what we need more of, and we lack in the United States especially, even in social work profession, is a social conscience. Cuba is one of the places where a social conscience is a priority and is respected and appreciated and nurtured. If any of you, for those of you who've worked in the medical system or the service system in the United States, you know that the social conscience is not necessarily considered a positive. And so I think if we can come out of this with a greater appreciation, as many young people seem to be having, for the potential value to each of us to be concerned and considerate and good to each other. That's my thought for the day.
I was wondering what hurdles might be faced by graduates of that school coming to different countries, or including this country, as far as, Saul mentioned, have you ever done anything in the United States? But what about examinations, or what other obstacles are there, I guess? Or are there many?
Yeah, so one thing I've noticed with US students, a big hurdle is taking the board exams, the United States, the US MLEs, United States Medical Licensing exams. A number of the graduates haven't, and yeah, that's a huge issue. That's why the people who in the first year, when it first started, the first few years, a lot of those students, from my understanding, weren't even aware of what it was. And to be able to enter a residency program in the US, you have to have taken the first 3 exams. And so, yeah, we're getting better about it. I've already taken the first 2, and like I said, the next one has been canceled for another year or so. So we're getting better about it, and part of that struggle is just because from what I've heard, a lot of the medical schools in the U.S. Really put a focus on that, because those tests are so important for medical students. But for us, it's not even part of our curriculum, So the way they ask questions, things like that, it can be tricky. So studying for them is key, and passing them. And then, like I mentioned before, getting clinical experience here in the U.S. just to be able to show your skills, because we get a lot of clinical time there, much more than you do in the U.S. And so we're excellent clinically. Like that's one area where Cuba really shines, is primary healthcare. Just getting on a really good physical exam, these basic things they're great at. So just getting experience and showing people in the U.S. that's what we can do. Sometimes it can be hard, but yeah. So those are two struggles for sure.
Anybody else? Mindy?
Just real appreciation for you, David, and Cindy, and Saul. That was just terrific. Thank you.
Thank you.
Well, it's inspiring, what Walter was saying about this idea of having a moral conscience about healthcare, and what seems to be possible and when things, it gives me some hope.
Dana?
Yeah, I guess this would be a question for Cindy. So, you know, the cities have passed resolutions for years, for a long time, at least 30 years, 40 years probably. And somehow it never seems to filter up to the feds. And I'm just curious, can Congress lift the blockade on its own? Or does there have to be a presidential decision, or how does it work?
You know, under Obama, he was able to lift certain portions of the the blockade, but he was never able to lift significant portions. And it really does take an act of Congress and a vote by both the Senate and the House to lift the blockade. And that's been the problem. So, however, even when the Democrats were in control of all three levels, they still did not lift the blockade. And in part is because of the state of Florida. And fortunately, as the old guard, those that fled Cuba after the revolution are losing power. They're dying off. And the new generation of young people want to be able to travel freely to Cuba. They want to find out about their families, and they want freedom to do that. And they don't want to see their relatives and the country being weighed heavily down by the blockade as it is. So, you know, it does, in some ways, the resolutions do help to show support for lifting the blockade, but it's also helpful in Cuba to know that people in the United States are continuing to organize to change US foreign policy to Cuba. Much of Cuba knows about our work here in the United States. Anytime there's a resolution passed, it's played on media all throughout Cuba. And so it's uplifting for the people of Cuba to know that people in the United States do not agree with our government policies around Cuba. So for both sides, it's helpful.
Yeah, it's my understanding that most people in Florida now, including a lot of the Cubans, are for lifting the blockade, just as most Americans are for lifting the blockade.
Right.
Which doesn't say anything for our Congress, because most people are for Medicare for all and a lot of other good things. And
Right. Before they closed down the cruise ships to Cuba, 500,000 US peoples had traveled by cruise ship to Cuba. And they were traveling all over Cuba because airlines were going to different cities in Cuba. Today, only once the airport opens up, only airplanes are allowed now in Havana. And even Cubans will have to take, they'll have to drive to the other cities and take buses. And gasoline is very difficult. That's one of the problems with economic blockade, is gasoline is very scarce, also because of the blockade against Venezuela.
So Cindy, I'm sure you'll be traveling to Cuba as soon as the weather gets better.
Yes.
Do you have to be a woman to go on your trip?
No, you don't have to be a woman. I take men. I take anybody now who wants to go to Cuba.
Well,
yeah, so.
Some of us have been there, so we don't want to fill up those slots, but anybody on this thing tonight who hasn't been there.
Of course. I'll let anyone on this call is welcome to come, and I'll let you know through David when my next trip will be, but I probably won't be until after they find a vaccine. So.
How long is the trip?
I usually try to do a 10-day, but I always want to fit so much into the trip. It's usually 2 weeks, and it's worth it. I mean, Deb can tell you how worth. She's been on a couple of my trips, and try to give you a mix of both the rural areas and the cities. I like to spend a lot of time outside of Havana so that you can really see the benefits of the revolution. You can talk with people. I do have a focus on meeting with women in the different communities, but go to agricultural collectives, go to hospitals, go to clinics, and have a good time at night.
But there is good time for rumba, right?
Oh, yes, yes. Rumba and rum.
Sherry, are you raising your hand?
Yes, yes. I just wanted to point out that the comment about having to have a social conscience and the like, once upon a time, the profession of medicine was organized exactly that way. It goes back to the time of Hippocrates. So it's relatively early time, I mean, maybe 2,000 years or so, that physicians took an oath to put their patients' interests ahead of their own. And we have gotten so far away from that in American medicine, as the whole system is organized around making money, for some anyway,
Right.
that we have just completely lost touch of our obligation as physicians to take care of our patients first. Now Cuba is doing that as part of a system that's a communist system. You don't have to be a communist country to do that. Most countries, Europe and Canada, Japan and Australia and the like, are organized around medicine as a public service, if not focused exactly on the Hippocratic Oath, but it lends itself to that. And that's the big change that needs to happen in the US, which is of course why we're all in PNHP and PNHP Western Washington. But I did want to bring in how that relates to having a conscience and the physician's oath to do that. End of comment.
Okay, then one more thing. Many of us knew Kevin Zeese and certainly Margaret Flowers. They came to Seattle a couple of times to help us with our annual public meeting and also for a couple of our monthly meetings. And Kevin passed away unexpectedly a few days ago.
Oh my God.
In his sleep.
Oh.
He is just an incredible person with a history going back decades for being involved and leading on all kinds of social justice issues. So I think we should take a moment here to just think about Kevin and keep him in our sight as a leader and someone to emulate as we move forward on these very treacherous times.
David, I have a quote from Kevin. It was April 22, 2013. An alternative government announced the Green Shadow Cabinet, in parentheses, I serve as Attorney General, Margaret Flowers as Secretary of Health. Thank you.
Well, on Saturday, there's going to be a online memorial in tribute to Kevin that's going to involve his kids and Margaret's kids. Margaret was his longtime partner, and they did Popular Resistance together, which is a daily compilation newsletter type thing of, you know, struggles going on around the world that I think we all should definitely have in our mailbox. Although some of those articles are, you can take a whole lot of time reading them. Anyway, I will give you the link to the service on Saturday, which I think is around noon our time.
Great loss to the movement.
Everybody who knew him feels that loss in their, basically, in their heart.
I loved Margaret's comment this week that she said Kevin and I were so close that some people thought we were one person and they used to call us Marvin.
David?
Yeah.
We can discuss this at our board meeting on Sunday of some kind of action to take on behalf of PNHP Western Washington in honor of the life of Kevin Zeese. I'll put it on the agenda.
Great. But be sure to be there on Saturday because I'm sure it's going to be a very moving tribute.